Good evening. My name is Dr. David Doman, and welcome to another edition of Housecall. What's new with MedChi, the Maryland State Medical Society? Find out more right now. My guest this evening is Dr. Shannon Pryor, President of MedChi, the Maryland State Medical Society. Dr. Pryor, welcome to Housecall.
Thank you so much. I'm happy to be here.
So, Shannon, briefly tell our viewers about your professional background.
Thank you. I am originally from Louisiana and went to medical school at Tulane and moved to Maryland in 1993 to do my internship and residency at Johns Hopkins. I became involved with MedChi, the Maryland State Medical Society, right away on my arrival in 1993. And throughout my tenure as a practicing physician, I am currently an otolaryngologist working with a large academic practice and also spend my time with organized medicine, MedChi, volunteering with AMA and doing some other work. I focus on ears, did my fellowship at NIH in Bethesda, and it's been an interesting journey, I would say, over the past few decades.
Very interesting. So you mentioned several aspects of organized medicine. Share with our viewers what's the difference between the Montgomery County Medical Society as opposed to MedChi, the State Medical Society, and then, of course, the American Medical Association, the AMA.
Certainly. The unifying factor in all three organizations would be that we strive to represent and advocate for the practice of medicine by all physicians, regardless of specialty. And the distinctions would come in the scope of that representation. Montgomery County Medical Society is focused on Montgomery County, Maryland, and advocates for, works with physician members who work or practice or live in Montgomery County, Maryland. And their efforts are focused in that area. Maryland State Medical Society, MedChi, has a slightly broader geographic range, but once again, we're serving all of the physicians who are practicing or living within the state of Maryland. And the American Medical Association brings together all of the physicians practicing and licensed within the United States. So it's a similar mission with a different geographic scope for each organization. And all of these organizations work together very closely.
Now, I would imagine it's interesting because I expect you're advocating not for one group, but for two. One, of course, is the physician community, but by extension, aren't you also advocating for the broader patient population?
Everything we do is absolutely focused on allowing us to provide the best possible care we can for our patients and to better the public health in that manner. Essentially, we want to be the foremost advocate and the foremost resource, not only for physicians, but also for patients and for public health.
How have you seen the Maryland State Medical Society evolve over the years? You've been a member, as you said, going back to 1993.
It has undergone quite a number of changes, and probably the most salient have been changes in the demographics of our leadership. When I started as a member of MedChi, as a resident, we had never had a female president despite almost 200 years of existence. And now I'm actually the 5th female president of MedChi, and our executive committee, consisting of our immediate past president, current president, and president-elect, is all female for the first time ever.
Wonderful.
So that's quite a change. In addition, we've also had quite a bit of additional diversity in our board of trustees in terms of nationalities, race, gender, everything. So that has brought a broader viewpoint to the organization. Also, I think we've been able to allow a little bit more engagement and involvement from our younger members, especially our students and residents, and their increased engagement has really benefited the society. We can look forward a little bit more.
Now, you have a one-year term as president. Uh, Tell the viewers what are the many roles you fulfill as president of the Maryland State Medical Society.
Well, the term is 1 year as president, but there's a 3-year process as president-elect, president, immediate past president. During that time, I serve on the executive committee, the group of 3 presidents who can often make decisions and meet regularly in between our board meetings and in between the House of Delegates meetings. So if a decision is urgent, we're all 3 going to be involved in that process. Also, I'm kept up to date essentially daily with what's going on. When MedChi is forming alliances, I'm involved in that decision-making process. Especially during the COVID crisis, one of our most prominent roles as members of the executive committee or as president would be to serve as the face of the organization to help with educational and outreach efforts.
Now, recently we've had the Maryland legislative session. What do you view as some of the major legislative issues that were addressed during the session?
One of our greatest, I think, wins during this legislative session is an increase for Medicare funds. We have an increase in terms of physician pay, which helps access for patients. There was also an increase in the amount of time. There's funding for vulnerable individuals, pregnant women postpartum, and that time frame has been expanded up to about 1 year, which is a good win for us. In addition, one of our highest priorities was telemedicine. As you know, this kind of leapt to the forefront during the COVID crisis, and both patients and physicians felt that the implementation of telemedicine was a very positive development. It allows equivalent efficacy with much more convenience to the patient and actually allowed the provision of care to patients who otherwise might not even have access. So we wanted to ensure that physicians and patients could continue to use telemedicine on an ongoing basis. Part of the legislation that passed actually allows parity for audio-only telemedicine to continue to be implemented. And that's important because some of our patients don't necessarily have the access to the technology for an audio-visual visit. This means that those vulnerable patients continue to have access.
You mentioned COVID several times. What were some of the biggest changes you've seen during the past tumultuous year in terms of COVID and private practice?
As you know, many practices closed for months at a time. Many practices, unfortunately, closed permanently, and many physicians retired. But once we got up and running again, as we talked about, telemedicine was probably the biggest change that was absolutely brought in as fast as possible and turned out to be a very positive thing. And telemedicine, as I mentioned, is probably here to stay. So that may be the biggest change that we've seen. One of the more negative situations that has arisen is a number of patients have had to delay their care or delayed their care out of fear of going to a healthcare facility during that time. And we are concerned about the possible ramifications of patients who have delayed care that was potentially needed. Many surgeries were put on hold for weeks or months. And some of those surgeries, while they may not have been urgent, were not elective. They were necessary surgeries. And many surgeons are still working through the backlog of cases and patients that need to be cared for. So that's one of the negative things that has happened.
Unfortunately, during this tumultuous time, particularly during the prior Trump White House, public health measures that were advocated by Dr. Fauci, Deborah Birx, the CDC, were politicized with the Trump White House. Things such as masks or a premature opening of businesses. What was the position of the AMA and MedChi considering the politicization of these public health measures?
So both AMA and MedChi have continually urged that decisions regarding regulations around public health measures should be based on science. And MedChi actually called for a mask mandate in April of 2020. And we did that because the scientific evidence supported the use of masks. And the continual message has been, let's look at the science and let's act in the interest of public health, not in the best interest of whichever faction or party wants you to believe. There is data out there about some of these measures, and we should follow the data and do what is encouraged there.
We have 1 minute before we go to the break. In terms of the vaccine hesitancy, what do you say to viewers that are reluctant to get a vaccine?
I understand that this vaccine process has been rolled out faster than any other vaccine development process in history, but the FDA has not abbreviated their processes for approving the vaccines. When the vaccines have been approved, they're being used in the populations on which they've already been studied. And if we want to curb this pandemic, then getting vaccinated is going to be a critical part for everyone who's eligible. And eligibility is now open to all Marylanders over 16. So the dangers of getting COVID and becoming quite or even critically ill from COVID are more significant than the minimal side effects that have been experienced with these vaccines. So we absolutely urge everyone over the age of 16 in Maryland to go ahead and either register or drop into one of the mass vaccination sites during the appointment times and get vaccinated as quickly as possible. That will allow us not only to protect ourselves, but to protect the vulnerable members of the community.
Excellent response. More with Dr. Shannon Pryor, president of the Maryland State Medical Society. We're going to a public service announcement. We'll be right back. We're back. My guest this evening is Dr. Shannon Pryor, president of MedChi, the Maryland State Medical Society. Dr. Pryor, we were talking briefly before the break about vaccine hesitancy. Let's explore further the insider's view as you've experienced it with the challenges of the vaccine rollout statewide. What have you been hearing?
Well, the beginning of the process was a little bumpy in just about every state, and Maryland is not necessarily an exception to that. But the governor's office worked with us, and the county health societies worked with us very assiduously in order to try to get the vaccine out as quickly as possible. And the state has been effectively addressing the inequities in vaccine access. MedChi has been helping, and we've been advising throughout that process. Finally, now we're seeing that physician offices are beginning to receive supplies of vaccines. So those primary care physicians who have been poised and ready to administer the vaccine all this time are finally being able to implement that and care for their patients in this particular way. In addition, Maryland has now opened the pre-registration for all adults, and we expect, now that some of the data on the trials for adolescents are coming in, we expect that we'll be able to open that up as soon as the FDA approves the vaccines for that population. So things are definitely looking up in terms of vaccine availability and distribution. MedChi is also assisting with recruitment of physicians for volunteering to work at those vaccination clinics.
Very good. Unfortunately, historically, the African American community has been reluctant to participate in the vaccine program, partly because historically there was the national shame of the Tuskegee syphilis experiments decades ago. Has the AMA, and in particular MedChi, had any sort of educational outreach programs to the African American community?
So the AMA has, and I can't speak for the AMA in this venue, but the AMA has absolutely put on quite a few webinars and has featured the issue of equity and outreach in their podcast, their COVID podcast, on a regular basis. But again, I can't speak for AMA directly. MedChi has absolutely been assisting with advising on that. We have not produced specifically targeted educational materials, but we have helped individual physician practices in terms of developing a message and helping to educate physicians on how best to deliver the message and talking points to talk to individuals who may be hesitant or frightened of receiving the vaccine. And again, we are working with the state on addressing the initial availability or equity issues that arose early on.
You mentioned before the break that when the COVID-19 pandemic first hit a year ago, many medical practices had to simply close, and many physicians simply threw up their hands and retired. What did you hear about some of the financial strains these practices went through?
Well, physician practices, especially private practices, have relatively high overhead costs. There are often a number of staff that need to be paid. There are high costs of not only offices, but equipment, which is sometimes leased or rented. And in addition, the cost of personal protective gear went up quite a bit during the time that that gear was in acute shortage. And all of these rising costs with absolutely no income can be very challenging when a practice is working on a very limited cash flow. And when employees are let go, it's very hard to hire them back up again. Many physician practices, MedChi did assist many physician practices in applying for the PPP CARES grant program to allow them to continue to maintain their staff and keep the office open during the time that they were not able to see patients. But there simply wasn't enough grant money for everyone who potentially needed it. So even though we assisted hundreds of practices, it still wasn't enough to keep everyone open. A number of physicians, I believe, also simply closed their practices because potentially they were reaching the end of, or they were reaching retirement age and simply cut a few years off early and just said, you know what, it's going to be very difficult financially to reopen my practice, to come back from this. Maybe it's time to go ahead and retire from care.
How many practices do you guesstimate actually simply closed in the past year?
I don't actually have the numbers. We did a survey and it was surprisingly high, but I don't want to quote an inaccurate number. It was above 20% in the
20% of the whole membership?
But that, no, not membership. This wasn't Maryland, this wasn't MedChi specific. But I wish I had the exact number for you, but I don't.
Now, with all this stress, not only financial, but also the challenges of being a physician each and every day, what was your sense about physician burnout? Was it exacerbated over the past year?
Physician burnout has absolutely skyrocketed according to just about every survey that we've seen and every measure that we've seen. And while there's been more recognition of the burnout, there haven't been quite as many effective solutions put into practice or identified. The thing to remember about burnout is it's not about the individual physician. We're talking about a systemic issue or a systemic problem based on the way that our healthcare system is expecting our providers to work and the way in which the regulations and the expectations are piled upon us. And the time of COVID only made that significantly worse. MedChi has done a number of things. We've been trying to ease the administrative burdens on physicians, which really, really contribute to burnout. And we also, MedChi is basically administers the physician health program, which serves physicians experiencing burnout. Also, there are programs within Maryland, such as the National Capital Physicians Foundation, which was founded by a subset of the Montgomery County Medical Society, which offers free counseling to physicians who may be in the early stages of experiencing burnout and who feel that they need help in order to determine whether or not they wish to continue. So we've come at it from a number of different directions, but it continues to be a significant problem, and the COVID crisis absolutely only made it worse.
Now, one of the hot topics statewide and nationally before the pandemic was the opioid crisis, which has somewhat been pushed out of the headlines over the past year, and yet the crisis is still very real, and it could be argued is even worse than it was before the pandemic. What is your sense about the opioid crisis in Maryland? Is it still a big issue?
It's absolutely still something that is still in a crisis level. And not only that, MedChi has continued to address this. Certainly COVID has taken the spotlight, but our opioid committee, which was founded in 2017 as a task force, was found to do such important work. And with the ongoing crisis, it was converted into a committee and they continue to meet. Some of the things that we've put together are a toolkit for physicians, manage individuals who are affected by the opioid addiction problem. We have continued to try to develop policies and guidelines for treatment, withdrawal treatment, such as buprenorphine, a lot of educational resources there. And we have put on quite a bit of physician education, CME, webinars and educational programs to help educate physicians regarding the crisis. So even though you may not see that work out front and center, we're absolutely continuing it because we think it's still a crisis and it's still critical that we address this.
Another hot topic, more recently described, has been racial inequities when it comes to healthcare access. Some people even call it racism. What is being done by the AMA and certainly MedChi at a statewide level to address these inequities?
Again, I don't want to speak for the American Medical Association in this venue, but from the MedChi point of view, in January of 2020, recognizing that this was an increasing problem on the public front, we established our inclusivity, diversity, equity, and access task force in January of 2020. And that task force has generated quite a few very good ideas, and a number of resolutions have come forward from that group. They continue to work. They're really focusing on the social determinants of health, equity, and access, and they're working with the state to support the effort to get the vaccines into the people who need it, talking about the disparity issues, not just with COVID vaccination, but with access to care in general. We're asking the state to increase the reporting of health data to identify those disparities so that we can address them better. And we've also released a statement declaring racism as a public health threat. So we continue to see excellent ideas coming out of our idea task force. And while we're working for the day when it will no longer be necessary, we will be continuing that task force for the foreseeable future.
Shannon, we have 1 minute left. Very briefly, another emerging public health crisis locally and nationally is gun violence.
Mm-hmm.
Certainly as the pandemic seems to be winding down, unfortunately, we're now seeing mass shootings crop up almost weekly. What is the position of MedChi when it comes to gun control that recognizes the need for public safety without violating one's Second Amendment rights?
Mm-hmm. MedChi has taken some positions on gun control. While we don't have any blanket provisions or policies, we absolutely have come out with regard to long gun sales, supporting background checks, gun safety courses. We have also supported raising the purchase age for a long gun to 21 years old. And we've also supported the development of a waiting period for long gun sales. So those are measures that were all researched and brought to us by our medical student section. So we're absolutely proud of their advocacy and their work on these issues, educating us, the practicing physicians, on what the best measures are to protect the public health while preserving the right.
We are out of time. Thank you for an excellent interview. If our viewers have any questions, how can they reach MedChi?
Well, our website is www.medchi.org, medchi.org, and there you will find contact information for the organization. We hope that all physicians will join, make a difference, and join in our advocacy efforts, and join in becoming one of our resources to care for our patients. And just reach out, take a look at our website, and you will find the contact information there.
Thank you for an excellent interview. My thanks to Dr. Pryor for a very informative 30 minutes together. My thanks to my team at the studio for making this show happen. And thank you, the viewer, for welcoming us into your home. Tell us how we're doing. You can reach me at my practice website, montgomerygastro.com. As for our next show, it's going to be a very important one. We're going to focus the entire 30 minutes on the statewide opioid crisis. And we'll be interviewing Dr. Olson from MedChi, who is the chairman of the opioid crisis task force team. Should be a fascinating, important show. See you then next time for another edition of Housecall. Good evening.